Hello, and thank you for your interest in the courses offered by the Interdisciplinary School of Health Sciences of Savitribai Phule, Pune University. We are one of the over 50 postgraduate departments of this university. As the name implies, the focus of the teaching and research activities of the school is on public health. Like for example, the zoology department deals with animals, botany with plants, microbiology with microbes. At the School of Health Sciences, our focus is on public health. We offer 2 master's courses, an MSc in Health Sciences and a Master of Public Health. In addition, we have PhD in Health Sciences and PhD in Public Health. In addition to our postgraduate teaching, there are several major ongoing research projects at the school. There are many PhD students who are in the department and who are working outside the department. We offer our master's students the opportunity to work in these projects. As there are currently no undergraduate courses in public health, this is the outline of this presentation. I will first explain what is the science of public health. I will then teach I'll talk about what we teach during the master's course. I will explain what is the difference between health sciences and the Master of Public Health courses. I will go ahead and talk about career opportunities after doing these courses, and then I will briefly describe the application process and the entrance examination. So, let me begin by asking the question, what is the science of public health? Basically, public health is defined as the science and art of preventing disease and promoting health. Let me illustrate the science of public health for you. This, for example, is a message that has been put out by the Ministry of Health, Government of India. It is to warn pregnant women about the danger signs during pregnancy. If women are aware of these danger signs, then they can contact the nearest community health worker, present themselves to their doctor, so that the complications of pregnancy can be managed. In this case, the public health activity is targeted towards reducing maternal mortality, that is, deaths of pregnant women. Here is another example. This is a recent initiative of the Government of India. It is called Mission Indradhanush. It advises parents to get their children immunized. As you know, immunization is one of the most powerful public health tools which can protect children, keep them healthy and ensure a productive and healthy, happy life. This particular public health message is targeted towards reducing child deaths and ensuring reduction in the number of illness episodes of children. I will give you one more example, and that is of TB control, and I am sure you have seen these advertisements on television frequently. The underlying message comes here is that public health is the science of prevention. For example, we talked about preventing maternal deaths, child deaths, tuberculosis. It is also the science of promoting health. For example, a vaccinated child has fewer illness episodes and is healthy. I would like you to note that public health works at the population level, and this is the biggest difference between public health and medicine or other disciplines such as physiotherapy or medicine or dietetics. What happens, for example, is that a doctor treats an individual patient. A dietitian gives advice to an individual patient. In contrast, public health works at the level of population. Public health professionals work among groups of people, for example, amongst children, pregnant women, elderly, obese individuals, people with tuberculosis, so on and so forth. So, let us ask the next question, what do public health professionals do? The first answer is that public health professionals have the skills to systematically analyze a health situation, to understand why a disease or a health condition is occurring amongst a group of people. Using this data, a public health professional can act to prevent and control disease, keep people healthy, and provide treatment to those who are unwell. So, let me underline for you the key activities of public health professionals. They collect evidence and they use the evidence for action. In this context, may I just tell you that public health is not social work, although at the heart of every public health professional is the endeavor to work for vulnerable people. Please remember that all public health actions are supported by strong metrics and the activities are tested to determine their effects. So, what exactly do we teach in the MPH and the MSc Health Sciences courses? Well, the two core courses of public health are the courses on epidemiology and biostatistics, and we have more than one course on these two subjects. Now, what epidemiology supported by biostatistics do is it imparts the skills to measure diseases in populations, identify who is getting affected, when, where and why, and identify the impact of interventions. In addition to epidemiology and biostatistics, we talk about infectious and non-communicable diseases, we talk about mental health, we talk about injuries. We talk about their global distribution, we talk about their difference in distribution between developed and developing countries, we talk about the Indian situation. Now, whilst learning about these specific topics, we teach a lot of supporting subjects such as these. When you come for a course in public health, you will come across a lot of new things which may not have been taught in undergraduate courses. For example, environmental health, urban health, public health nutrition, health systems research, clinical and field trials and so on. Our practical exposure to public health is done through a lot of rural and field based settings. We have a rural community health training area which is located 1 hour away from the university. Under a primary health center, there are about 36 villages covering 80,000 population. And what we do is we use this situation for in-field actual and real training so that students can understand the health system, disease control programs. We are also extensively helped by the public health services, and many of their officers come in and help in the teaching program. So, let me just list for you the practical skills in the field of public health sciences. We teach students how to conduct epidemiological studies, qualitative research methods, developing a research proposal. There are laboratory based measurement of health and disease biomarkers. There is extensive computer based data analysis skills, including learning several epidemiological softwares. And because public health professionals work very close to people, ethics and biosafety principles are very, very important practical skills that we teach. So, let me underline for you that practical skills in the field of public health sciences involves a wide range, which involves learning in the field. For example, how do you sample out a representative population from the 30 lakh residents of Pune city to doing lab based studies such as measuring antibiotic resistance. So, what is the difference between the MPH and the MSc Health Sciences courses? In the MPH course, we give a focus or a strong concentration on program management. That means that we teach how to manage programs, we teach health economics, we teach leadership, we teach governance. Health sciences is more of a public health biology course. It is more of an academic course with a focus on epidemiology of diseases and other health conditions. We generally place MPH students in services, health sciences students go more into academics, but please remember that these divisions are not watertight. And another thing is that with a background in either MPH or health sciences, it is always possible to do a PhD and go into academic careers. Now, where or what are the career opportunities? The career opportunities are in national and international NGOs, other developmental agencies, in academic field, that is as faculty in public health schools, in government agencies, and many of our students are here in working in India and abroad. What are the particular attributes that you need to have in order to work in the field of public health sciences? First of all comes that you have to work very hard. The second and very important point is that you have to think interdisciplinary. If you like the subject that you are doing, if you are very passionate about it, public health may not be the field for you. In public health, you have to do a whole spectrum of subjects because these are what determine human health. You should be willing to travel, to stay and live in hard conditions. You should enjoy interacting with people, but underlying all this, you should have the ability to think critically, systematically analyze situations. As I mentioned earlier, at the heart, you should be interested in social issues, in the welfare of the health of people, but please do remember that public health is a very hard, systematic science. Finally, about the application process, the application is online. Please do check the university homepage. The entrance examination is scheduled on the 25th of June 2016 at 10:30 a.m. and the exam center is on the Pune University website. Please do again check the website for further details. So, thank you very much for your interest. For further queries, please do email me at dranitaccar@gmail.com. Thank you.